Hi, I'm Amy. I'll be your primary nurse today. I'll wash my hands.
I am bleeding. Ouch!
Please state your name and date of birth.
My name is
Fatime Sanogo.
I was born on July 8th, 1998.
Everything matches. Are you allergic to anything?
No, I am not allergic to anything.
I'm going to raise your legs.
Okay.
I'm going to perform some assessments to see how you're doing.
Okay.
We know it is tough. Try to relax and we will help you.
Okay.
She is breathing at 20 breaths per minute. The chest is moving equally. This is a pulse oximeter, which monitors the oxygen level in your blood. It fits snugly around your finger, but should not hurt.
Ouch! Okay.
I'm going to take your temperature.
Okay.
The temperature is 99. I am attaching this blood pressure cuff so we can monitor your blood pressure continuously.
Okay.
I'm going to assess your perineum.
Okay.
There is minimal redness, minimal edema, no ecchymosis, and no discharge from the repair. And it is well approximated. There is a lot of blood and lochia in the vaginal area. She is bleeding at a moderate rate. I'm going to check the bed for any signs of fluid, blood, or lochia.
Okay.
There is a large amount of blood and lochia on the bed.
Ouch!
I'm going to change and weigh the bed pads.
Okay.
The increase in weight of the bed pads suggests that approximately 1,150 milliliters of lochia was on the pads. The time since the last change of the pads suggests a bleeding rate of approximately 2,040 milliliters per hour. I'm going to massage your uterus.
Okay.
The uterus did not firm up properly. I'm going to scan your bladder.
Okay.
The bladder contains 300 milliliters of urine. I'm going to examine your uterus.
Okay.
The uterus feels soft and boggy. Let me just assess your IV.
Okay. Is something wrong? Ow!
No, the site has no redness, swelling, infiltration, bleeding, or drainage. The dressing is dry and intact. An infusion of 20 milliunits per minute of oxytocin induction. Milliunits per minute is running. 2 milligrams of butorphanol tartrate has been given. How bad is the pain on a scale of 0 to 10?
It's pretty bad. I'd give it a 5. Ouch!
I'm going to call your provider.
Okay.
I've explained the situation to the provider, and she has entered some new orders in the medical record in order to stop the bleeding. An infusion of 500 milliliters of lactated ringer solution over 10 minutes has been started. She is breathing at 21 breaths per minute. The chest is moving equally. I'm going to verify the dose with another nurse.
Okay.
The dose is correct. An infusion of 500 milliliters per hour of oxytocin postpartum milliliters per hour has been started. She is breathing at 21 breaths per minute. The chest is moving equally. I'm going to examine your uterus.
Okay.
The uterus feels soft and boggy.
I'm going to perform a straight catheterization to drain your urine. It may be uncomfortable during insertion.
Okay.
The bladder has been emptied. There was about
I'm going to
300
examine your
milliliters
uterus.
of urine in the bladder.
Okay.
I cannot do that right now. The uterus feels soft and boggy. I'm going to call your provider.
Okay.
I've explained the situation to the provider, and she has entered some new orders in the medical record in order to stop the bleeding.
"800 micrograms of misoprostol has been given.
How bad is the pain on a scale of 0 to 10?
It's pretty bad. I'd give it a 5.
I cannot do that right now. Five milligrams of morphine has been given. I'm going to call your provider.
Okay.
I've explained the situation, background, assessment, and recommendation to the provider. The provider is coming to see the patient. We will continue with existing orders. I'm going to call your provider.